uniforms. Yeah, that's why I turned my back. Yeah.
Look at us and read our signs. It's negotiating time.
네, 현재 저는 온타리오 간호사 협회의 도움으로 파업에 참여하고 있습니다. 온타리오주 관광문화게임부 장관님 지역구 사무실 앞에 나와 있습니다. 저희는 협상을 통해 공정한 임금을 요구하고 있습니다. 지난 몇 년간 물가 상승에 비해 임금 격차가 점점 더 벌어지고 있습니다. 저희 고용주는 현재 임금 협상과 관련해서 도움을 주실 수 없다고 하셨습니다. 온타리오주 보건부에서 받은 자금을 가지고 저희 임금을 올렸어야 되는데 저희 이사회에서 임금을 올리지 않고 지난 몇 년간 임금이 동결된 상태라 이렇게 나오게 되었습니다.
왜 조성훈 장관님의 직접적인 도움이 필요하다고 생각하시나요?
윌로우데일 지역구 의원이신 조성훈 장관님께서 이 문제를 해결해 주신다면 더 신속하게 빠르게 문제가 해결될 수 있다고 믿고 있습니다. 제가 근무하는 노스욕 패밀리헬스 팀은 온타리오주 보건부의 자금을 지원받아 운영되고 있고 온타리오주 1차 의료 비영리 기관으로 현재 9만 5천 명 이상의 환자분들에게 만성질환, 예방의학, 발치료, 정신건강상담 등 다양한 1차 의료 서비스를 제공하고 있습니다.
파업에 이르게 된 핵심 원인은 무엇이었나요?
저희가 공정한 임금을 받지 못하고 있었습니다. 지난 몇 년간 임금이 동결되었고 저희가 1년 6개월 동안 이사회와 협의를 받지만 결국에는 임금 인상이 없이 계속 0%로 유지된다고 해서 저희가 어쩔 수 없이 파업에 나오게 되었습니다.
We have undergone 7 years of wage freeze. And since then, yes, there's been some increases, but far below the cost of inflation. There's no cost of living adjustments that are available to our organization. So then when the government finally says, okay, we're going to inject some money, we're going to provide these organizations funding to help with that, with the wages, to adjust for the cost of inflation, the cost of living, and that our organization makes the decision not to provide it, especially when we're at the bargaining table and they still insist on providing us 0%. But it's also about accountability, right? Accountability about the funding that was provided from the provincial government, from the Ministry of Health, from Ontario Health, to the North York Family Health Team to support recruitment and retention for the workers. And we have not seen any of it. Okay, it has still on the table. It is still 0%. No increase in wages and no increase in benefits. Okay, there is a policy that came with the funding from the government, and that policy says the organization is supposed to use it to effect an increase in wages or some level of compensation. Okay, it doesn't have to be increased wage. It could be increased benefits, pension, whatever it is, right? But to support recruiting primary care workers to the area. And they haven't given us 0% in wage increase, 0% change in our benefits as well. So the loophole that they found was, yes, we use that funding to pay for your benefits. We used it to pay for, because your benefits have increased in cost. Our benefits plan has increased in cost, the benefit premium. So they said, we're going to take that money and we're going to use it to pay off the benefit premiums. They knew that that benefit premium was going to come. Okay? They knew it before that announcement for the primary care, that recruitment and retention was announced by the government. They knew it was coming. But yet when the government finally said, okay, we're going to pay, the government said they announced this funding, our board of directors decided to use that money to pay off that benefit premium. That was a deficit that they knew was coming. Okay? But our benefits has not changed. No change.
대략적으로 저희 노스욕 패밀리스 팀이나 1차 의료 비영리 기관에서 근무하시는 사회복지사 분들에 비해서 병원에서 근무하시는 분들은 대략적으로 한 25%에서 거의 30% 이상의 연봉을 더 받고 있습니다. 이사회 입장에서는 현재로서는 많은 보건부나 온타리오 헬스를 통해서 이 문제를 해결했으면 좋겠다라는 입장입니다.
주정부는 이번 사태에 대해 어떤 입장을 보이고 있다고 보시나요?
이건 단순 노사 간의 갈등이다라고 생각을 하시고 이제 저희 이사회랑 저희 노조 측에서 해결을 해야 되는 거 아닌가라고 생각을 하시는 것 같아요. 온타리오주 보건부가 좀 더 저희 1차 의료 산업 전체 전반에 대한 약간 관심과 좀 더 많은 지원이 필요한 것 같습니다. 근데 특히나 중요한 게 이제 프로그램에 대한 지원뿐만 아니라 이제 워커, 그러니까 일하는 스태프들에 대한 임금 관련돼서도 격차가 너무 많이 나고 있기 때문에 이 격차를 좀 줄이는 것에 대한 이런 제도가 좀 더 마련되면 좋지 않을까 생각합니다.
The government to use their powers of oversight and to ensure accountability for taxpayers' funding, for taxpayers' money that was used for the primary care recruitment and retention. It's not sufficient just to say, oh, I'm investing, several $1 million into primary care, but you have no idea how it's being used. You have to ensure accountability, that the money is getting to the workers. If you intended the money to get to the workers, you have to ensure that it's happening.
현재 약 9만 5천 명의 환자들이 영향을 받고 있다고 하셨는데요. 구체적으로 어떤 서비스가 중단되거나 지연되고 있는 상황인가요?
1차 의료의 중요한 점은 예방의학이거든요. 그래서 아무래도 더 증세가 악화되기 이전에 예방하고 관리를 하는 차원이기 때문에 되게 저희 생각에는 의료 사업의 그 백본이라고 좀 많이 저는 생각해요. 환자분들이 겪는 어려움은 이머전시 케어나 아니면 더 다른 상급기관이나 다른 전문기관을 찾아야 되는 입장이라 그것 또한 웨이트리스트가 되게 길기도 하다고 알고 있어서 아무래도 기다림이 좀 많이 힘들어지지 않을까.
I think one of the biggest impacts will be the nurses that are usually working inside the family physicians' offices. They literally work side by side with the family physicians. They have been pulled. The family doctors that are used to having a nurse beside with them or being able to refer to a social worker for a patient who's struggling with mental health concerns or trying to deal with side effects or medication safety, they usually are able to refer quickly to a pharmacist or a dietitian for somebody who's having malnutrition or nutrition issues. They are having to handle that on their own or they must refer out. Right? A lot of the physicals, the well baby visits, some of the vaccinations, they're not happening. They're being canceled until this service disruption or until this strike is ending. Patients are not getting that care. The cancer survivors that normally would be monitored by nurse practitioners, they're having to wait to have their repeat scans or to do their blood work. You wait for the family doctor. Some patients are being referred to emergency departments. Normally they would just be referred to our team just to have a quick visit. We could review with them. The family doctors are so limited in their time, right? They don't have a lot of time to talk to you if you have concerns. So we provide that additional support, right? Some patients are a little bit more complex, need a little bit more time, a little bit more assessment. We provide that support, and that's not being offered right now. I worry about the patients first and foremost. Our patients, we have so many patients that are vulnerable, from the youngest to the old. So we worry about the patients that are not getting the care that a lot of the nurses have known some of the patients from when they were babies to now when the patients are having babies, right? So we're talking generations. The nurses feel the most pain that they're not able to see their patients. They always tell me on the line they miss their patients.
이번 파업이 의료진의 일상이나 생계에는 어떤 영향을 미치고 있나요?
오늘로 8주가 됐고 다음 주면 이제 9주가 되는 상황이라 그 기간 동안에 임금을 제대로 받지 못하는 상황이라 매우 어려운 것으로 알고 있습니다.
The first 2 weeks, there's still a lot of hope, right? There's still a lot of energy. Ontario Nursing Association has been amazing and fantastic in terms of providing us support and guidance in terms of what to do, strategy. But as the weeks have progressed, it has gotten harder. There's also been a lot of other unions that have come out to provide support. Donations have come in to keep us going. We are all not getting paid, right? We don't have benefits. We don't have pay from our employer when we're on strike. finances are a reality, right? People must pay bills. There are bills that still need to be paid. Life still goes on, even in a strike. Families, children, we all have families and children that need to be supported. So people will start leaving. People will need to make decisions. I worry that people will leave the team. The team will not be the same when we go back because this strike is so prolonged. And if it continues, if nobody decides to take responsibility or do anything, I'm worried the team will fall. The patients will fall through the cracks. I'm worried about that.
지금 가장 시급하게 이사회에서 취해야 할 조치는 무엇이라고 생각하시나요?
빨리 협상 테이블에 나와주시는 게 저희한테는 좀 큰 도움이 될 것 같고요. 커뮤니케이션 자체가 요새 지금 거의 안 된 지 좀 오래됐거든요. 아무래도 사회복지사로서는 환자들의 케어 이런 것들이 굉장히 중요하다고 생각하기 때문에 현재 이렇게 파업으로 일터에 떠나 있는 것 자체가 마음적으로 편하진 않습니다. 그리고 더군다나 저는 이제 심리 상담을 하는 사람이기 때문에 8주나 9주의 시간 동안에는 정말 많은 일이 일어날 수가 있지 않습니까? 그래서 하루빨리 돌아가서 일을 하고 싶은데 돌아갈 수가 없는 상황이라.
The board of directors, they need to come to the table. They need to come to bargain. They need to be creative, be innovative. We are a team that has been creative and innovative and award-winning for them. It is their turn now, the board of directors, to be creative and innovative, to find a way to bring an offer that's fair, decent to the table. We're not being unreasonable. We don't think we are being reasonable because other teams, they have received their recruitment and retention. It has happened, right? So make it happen for us at the bargaining table. That's what we want the board of directors to do.